Good afternoon to those on the East Coast and good morning to those on the West Coast. Thank you for joining us today on what will be an illuminating webinar on how wildfires can impact our health. As one of the biggest public health threats today, climate change is a health equity issue. Climate change causes higher temperatures, earlier snow melt, drier air conditions, and increases the frequency, intensity, and duration of wildfires. And wildfire seasons are expected to be longer and stronger across the US. And increasing development at the wildland urban interface is where more homes and people are at risk. And it is cyclical. Wildfires contribute to global warming by releasing massive amounts of carbon into the atmosphere and reducing the amounts of forests available to sequester carbon. My name is Surili Sutaria Patel. I'm the director for the Center for Climate Health and Equity at the American Public Health Association, and I'll be your moderator for today's webinar. Climate change increasingly presents serious, complex challenges to the public's health. And we're living in historic times where a long-term public health challenge has been met with an immediate one, COVID-19. And recent events have driven us to reevaluate our work in many ways. And we have strengthened our resolve for climate action with an emphasis on equity and social justice. At APHA Center for Climate Health and Equity, we lead public health efforts to inspire action on climate and health, advance policy, and galvanize the field to address climate change. With a long-standing commitment to climate as a health equity issue, APHA Center applies the principles of health equity to help shape climate policy, engagement, and action to justly address communities' needs. Our vision will be realized when climate change is threatened as a national priority with broad political and social support. In our vision, the nation will address climate change in ways that improve the public's health and advance health equity. And as such, we are pleased to provide this platform that we hope will inspire you to take action to adopt change. While all of us experience the health impacts of climate change, certain groups like children, the elderly, the underserved, and minority communities are less resilient and as a result, more vulnerable to the negative health impacts of climate change. Wildfires and the resulting smoke impact various groups in different ways. For instance, the very young and old are more sensitive to air quality impacts of wildfire. For children, their developing respiratory systems make them vulnerable to the long-term impacts of wildfire smoke, particulates, and ground-level ozone. Low-income community households are less likely to have disaster insurance and have fewer resources to cope with or rebound from home and property loss or temporary displacement. African Americans have higher rates of asthma and cardiovascular disease that increase sensitivity to health effects of smoke. Tribal communities, such as Native Americans and Alaska Native populations living near forested regions, are in increased risk of displacement, smoke exposure, injury, property loss, and more, especially if the populated areas are prioritized for fire management response. The undocumented families are not eligible for FEMA assistance, and even those who are eligible may fear applying, as immigrants may also have concerns about accessing evacuation shelters or other relief services due to inadequate cultural and linguistic competencies of service providers. For those who work outdoors, like farm workers or utility workers, they're also at risk of respiratory effects of smoke and pollution. Individuals with pre-existing cardiac or respiratory disease are at risk for disease exacerbations due to wildfire smoke. The emergency conditions created by wildfire disrupts individuals' ability to adequately manage their health conditions, and people with disabilities such as mobility, sensory, or cognitive may be at greater risk. And I would be remiss not to mention the dual reality that we're in with COVID-19. Those experiencing underlying conditions could be more susceptible to COVID and wildfire smoke could exacerbate their symptoms and worsen conditions. It's for these reasons and many more we're excited to offer this exciting webinar. Before we get started, I have a few housekeeping items. Closed captioning is available for today's webinar. The instructions on how to access closed captioning will appear in the chat box. The webinar is also being recorded. All registrants will receive a follow-up email, including the recording, the slides, and a survey to help us improve our webinar experience. The presenters and I are happy to take your questions at the end of all presentations, and you can enter your question via Q&A function at any time during the webinar. At this time, the chat function has been disabled for participants and will use for announcements only. But let's have some fun along the way. Follow the conversation on social media using the hashtags APHA webinar and hashtag climate changes health. And for more information on how climate change impacts health, please visit apha.org/climate. While we strive to offer a quality event today, I would also like to invite participants and panelists alike to forgive any technical challenges. Like yourselves, we're all operating out of our homes with limited or no tech support. So without further ado, I'd like to introduce you to our first speaker, Dr. Wayne Cassio. Dr. Cassio joined the EPA's division in the National Health and Environmental Effects Laboratory in 2011. Most recently, he serves as the director for the Center for Public Health and Environmental Assessment. He is a recipient of APHA's 2018 Homer Calver Award, an EPA Gold Medal for Exceptional Service, and an Office of Research and Development Impact Award, and numerous scientific and technological achievement awards. Wayne, you may unmute yourself and begin your presentation. Thank you.
Thank you, Cirilli, and hello to everyone. It really is a pleasure to be here today and to share some thoughts about an environmental health topic of growing importance to health officials and communities across the country. Today, my topic will be a brief discussion of the health effects of wildfire smoke. The greater sensitivity and vulnerability of some populations that Cirilli spoke to, and an introduction of EPA's tools and resources that are available for public health guidance and education. What you see in this image, taken from a paper from McClure and Jaffe, is that over the last 30 years, air quality has generally improved in the eastern and central United States, as indicated by the blue and purple colors, and air quality has worsened in the Northwest, as shown by the red and orange. This decrease in air quality in the Northwest is largely explained by increasing wildfire emissions. Wildfire emissions are more likely to be generated in rural areas, yet this slide illustrates the impact of wildfire smoke that people can, can occur in rural, suburban, and urban areas. In short, wherever the prevailing winds carry the smoke. Here we see agricultural workers working in the field, a middle-aged couple who possibly could have heart or lung disease walking along a city street, and a group of exercising bicyclists who are all being impacted by smoke. And remember, exercise increases respiratory rate and ventilation and increases the dose of exposure. Now, smoke is the most abundant pollutant in wildfire emissions, having relevance for public health, and smoke is a form of particulate matter, also called PM. We know a great deal about the health effects of air particle pollution because of extensive human health research required by the Clean Air Act and conducted over decades. The US EPA summarizes what is known about human health effects of inhaled PM in a document called the Integrated Science Assessment for Particulate Matter. The most recent is shown here and was published in late 2019. The publication synthesizes the body of science on the topic of PM and health and uses a causality framework to determine both short-term and long-term health effects of PM exposure. Based on the best available evidence, we can say with confidence that short-term exposure to PM causes cardiovascular effects and premature mortality, and likely causes respiratory health effects. The evidence supports a determination that suggests that PM has effects on metabolism, neurological function, pregnancy, birth outcomes, reproduction, and fertility. Health data on wildfire smoke, by contrast, is much more limited. Epidemiology studies of wildfire exposures have only been conducted in any significant number over the last 10 years. However, from these studies, we know that wildfire emissions likely contribute to all-cause mortality and worsen asthma, chronic lung disease, and childhood respiratory diseases. Wildfire smoke also causes bronchitis and pneumonia. Less well documented are effects on the heart, blood vessels, and birth outcomes. And whereas much is known about the long-term health effects of PM, little is known about the long-term health effects of wildfire smoke. Most studies estimating such effect, for example, estimating occupational risk, draw the effect estimate from long-term PM exposure rather than wildfire exposure itself. Now, in the same way that EPA's integrated science assessment offers information about causality, it also provides a summary of the strength of evidence defining at-risk populations. From the EPA's PM integrated science assessment, we learn that there is adequate evidence to conclude that children and non-white populations are at higher risk from PM, and increased risk is suggestive for socioeconomic status when low, smokers, and pre-existing heart disease, lung disease, obesity, and certain genetic factors. Evidence for wildfire smoke, again, is more limited, but generally follows the same pattern. Now, the strong association between ambient PM and cardiovascular health effects is predicted based on what we know about PM and cardiovascular effects. And we would predict that we would see such an association with wildfire smoke. Yet early epidemiological studies did not measure cardiovascular conditions, and those that did had relatively small study populations that did not show cardiovascular health effects. In our study, illustrated here, we found that one day after exposure to wildfire smoke during the 2015 California wildfires, all respiratory emergency department visits increased by 18%, all cardiovascular visits by 12%, heart attacks rose by 42%, and strokes by 22%. On the day of the exposure, heart rhythm abnormalities increased 24%. As the figure shows, these effects were most prominent in older adults and greatest at heavy smoke concentrations. So given that people with chronic diseases, children, pregnant women, and aged are all at higher risk, just what percent of the population does this represent? In the US, nearly 30% of all people fall into one or more of these categories. Yet from county to county, there is oftentimes great variation in the prevalence of these conditions. Other populations who might be at increased risk include people with chronic inflammatory diseases, for example, diabetes, obesity, women, non-white populations, and populations with lower socioeconomic status. In contrast to many pollutant exposures that have environmental justice implications, wildfire emissions and smoke do not differentially expose vulnerable communities. Yet when exposed, individuals of low socioeconomic status have greater morbidity and mortality risk from short-term air pollution exposures. In North Carolina, we found that counties having the lowest socioeconomic status indicators had the greatest risk of health effects from exposure to smoke from a peat fire. Why should this happen? It's been suggested that the greater adverse health effects in this population are due to less access to air conditioning, for example, or inability to evacuate, which may increase personal smoke exposures to lower socioeconomic neighborhoods. Also, higher rates of asthma in minority populations could increase risk of these health effects. As we consider interventions to reduce impacts, we must consider equity in design and implementation. So can communities that are more vulnerable to the adverse health effects from exposure to wildfire be identified based on underlying health status of the community and the likelihood of exposure? Anna Roppold, an EPA scientist, developed the Community Health Vulnerability Index for this purpose, based on factors known to increase the risk of health effects from wildfire smoke exposure. In the map, we see a county-level Community Health Vulnerability Index across our country. Interestingly, the Southeast has the highest incidence because of the generally higher level of annual PM from prescribed fire, as well as a population having a high level of prevalent risk factors. As we move into the future, impact from wildfire smoke will continue to grow due to the increasing acreage burned, as the figure shows. The trends are on the upswing. The continued expansion of the population into the wild and urban interface and the increasing size of the vulnerable population at the countries as the country's population ages. Today, nearly 10% of all land with housing is situated in the wildland-urban interface, and nearly 40% of all housing units are at risk from the effects of wildfire. The Wildfire Smoke Guide for Public Health Officials, which you see here, was released in 2019 and is a comprehensive source of practical information concerning health effects of smoke and what can be done to prepare for smoke, to limit exposure, and how to clean up after fire safely. Sections include smoke and urban particles, information on ozone, and sections on PM web course and ash cleanup. The guide is now accompanied by many standalone fact sheets about children, older adults, pets and livestock, pre-season preparedness, exposure reduction, and knowing when to evacuate. The EPA provides many resources health officials can use to educate the public about the risks of smoke exposure and actions people can take to protect their health. These include airnow.gov that provides current air quality, wildfire and smoke information about health effects of wildfire smoke, CME courses on PM, ozone, and smoke, and wildfire smoke infographics, and highly popular citizen science smoke sense app for smartphones. The one easy to locate source for all of the information is the Smoke Ready Toolbox for Wildfire, and the website address is on the slide. So thank you for your attention, and for more information, the links are shown for the 2019 Wildfire Smoke Guide for Public Health Officials and also for the Smoke Ready Toolbox for Wildfires. And I'll look forward later to your questions. Thank you.
Thank you, Dr. Passio. Now I'd like to introduce to you our second presenter, Melissa Newts. Melissa lives in Livingston, Montana with her husband and 2 daughters, and she is the Montana field organizer for Moms Clean Air Force, but she also serves her community as a Livingston City Commissioner. As a lifetime advocate for clean air and stable climate, she worked after high school for Nebraska Citizen Action, knocking on doors to advocate for wind energy. Melissa, please begin.
Thank you. Thanks, Sorley. I'm having a hard time with this slide here. Just a minute. Okay. Thanks, Sorley. I'm Melissa Newts. Montana field organizer with Moms Clean Air Force, an organization of over 1 million parents fighting for climate justice. Today, I'll speak about living with wildfire smoke and equity. I identify as a white, cis, heteronormative woman, use the pronouns she and her, and was raised in the dominant culture. Given my conditioning within white culture, I may unknowingly cause harm, and I apologize. I'm open to further conversation if I've caused harm and anyone wants to follow up with me later. We can't explore equitable solutions for wildfire smoke without first naming the systems operating in our country. Let's pause to remember some of what's happening right now, including the killing of Black Americans, injustice for missing and murdered Indigenous women, and that people of color are disproportionately impacted by COVID-19. Our country was founded with genocide of Indigenous peoples and enslavement of African peoples. The extraction of people and the extraction of resources are intertwined since colonization, and extraction of resources is fundamental to climate disruption and the reality of living with more wildfires and longer smoke seasons. This foundation impacts all policy today because some of the first policies were intentionally discriminatory. So today, each of us still live with different privileges, which may become more obvious as I share stories. I encourage you to keep in your mind and heart that systematic racism infiltrates all these topics, and think about how you would keep your own family safe during smoke seasons or any health crisis, depending on your access to clean water, clean air, stable housing, stable electricity, equitable healthcare, equitable education, job security and flexibility, and your ability to travel. 2017 was the perfect combination of factors, as predicted by climate scientists. We had the worst fire season in Montana since about 1910. This smoke map is a good reminder that while we talk about local solutions, wildfires are much bigger. Smoky air has a long reach and doesn't care about state boundaries or government jurisdictions. This Montana Department of Environmental Quality map shows air health based on particulate matter concentrations. Montanans use this information when making decisions for our families during smoke seasons. During the summer of 2017, the DEQ had to create the hazardous category for the map. Seeley Lake and this nearby campground had such dangerous air there was no category to classify it. We'd hear reports that the monitors were unable to record the air quality, for reasons including that the sensors weren't calibrated for this high a level of pollution, or the monitors were being clogged by dirty air. Residents were told to evacuate, now challenged to find and pay for additional housing for an undetermined length of time. This month, during a wildfire near Helena, the first recommendation was for vulnerable people to leave the area. While an ideal health precaution, it's expensive, not realistic for many, and problematic if these same vulnerable people are self-isolating during a pandemic. Montanans were living in an environmental crisis with no escape. Common advice is to leave the area or stay indoors with air conditioning and a HEPA filter. People with the most resources were able to leave the state. Most of us stayed home, continuing to work, even people who work outside. Scrounging to afford portable HEPA air filters, we found they were often sold out at stores and online. Out of desperation, people used wet bandanas as masks or put furnace filters on the back of box fans propped in windows. Turns out neither of these is particularly effective, and in some cases can make the risk of inhaling particulate matter even greater. A lot of people don't know wildfire smoke is even dangerous, equating it to sitting around a campfire, thinking it's more of an annoying smell than an actual health hazard. These photos are near Livingston, where I live, north of Yellowstone National Park. On the right, a day classified as moderate air quality, one category better than unhealthy, when children and older adults should reduce exposure. Realistically, this air probably wasn't moderate. The nearest monitor is beyond a mountain pass in a different airshed. It's common that communities have no access to local data to make informed decisions. This is also true for schools. This is near Florence. While it looks like the plains, it's actually the Rocky Mountains in western Montana. About 400 wildland firefighters had their base camp and headquarters on school grounds in Florence, green spaces covered with tents, and parking areas packed with food trucks and eating tents. Parents were uncertain how school would be impacted. School opened, and these same parents saw smoke visibly rolling in the hallways as they dropped off their kids. Nurses and school officials around the state told us they didn't have data to make decisions about whether it was safe for kids to play outside, and typically there's no air conditioning or HEPA filters in schools. This Libby school ground in northwest Montana sat empty. Recess was canceled in some schools for weeks on end. Kids were restless. Everyone was restless. There was no escape for most of us. Compare the sky using the signs for reference. 200 miles southwest in Missoula, pictured, a child remembers her teacher telling her classmates with asthma to hold their breath when she opened the classroom door to outside. It was their only practical defense to prevent asthma attacks. And remember that premature and low birth weight babies can have challenges that stick with them for life, including breathing challenges. These families have to do even more to keep their children out of the hospital. Again, staying indoors with air conditioning and HEPA filters is best, but many Montanans don't even have air conditioning. When most of our homes were built, the average summer temperatures were cooler. HEPA filters aren't cheap, and not everyone can afford them, let alone upgrading the HVAC systems in our homes. Most of us are left to choose between opening our windows to dirty air or risk a heat stroke with closed windows and slightly cleaner air inside. The Missoula Health Department secured and distributed HEPA filters to the most at risk in the county. Locals created an online resource, sharing places to breathe, like stores with air conditioning that allowed people to sit inside and breathe clean air for free. A grizzly bear nonprofit pivoted their cause to raise money for portable HEPA filters for the schools. Everyone's health was impacted to some degree. We still don't know all the impacts of prolonged wildfire smoke exposure, especially at these hazard levels. Families living with high pollution have shared that 3 years later, they never fully recovered from the symptoms that were triggered. At Moms Clean Air Force, we have a fact sheet about the risks of living with wildfire smoke and preparing for longer smoke seasons. Most recommendations are not equitable, in part because of pre-existing differences between our privileges. Many just can't afford air conditioning, HEPA filters, nor the correct masks, which may be an even challenge during this pandemic, let alone leaving their jobs and homes for days or weeks at a stretch. As always, impacted communities know their own solutions. Local air monitors. Do you have one? Does it work? How is it funded? In Montana, when the EPA budget is threatened, funding for air monitoring is at risk. As an elected commissioner, I've talked to our city manager about the need for local monitoring. Funding is a struggle, and he's reached out to nonprofits for creative solutions. Community resilience plans. Do you have designated clean air spaces and a way to distribute HEPA filters? Schools. What do they do to protect your child during smoke season? Do they have access to air quality data? Does the school have air conditioning and HEPA filters? Join Moms Clean Air Force. It's free and we welcome everyone. We'll help you connect to influence federal policy impacting our air and climate. Finally, who is talking about equity really matters, because the dominant white culture can be unaware of our blind spots to fully seeing inequity. In other words, we don't know what we don't know. If the institutions suggesting the prescriptions for healthy communities only view equity and solutions from seats of privilege, we'll continue to miss critical and life-saving opportunities. So I'm going to make a request for each of you here today. Let's radically shift the lens of how we view equity and stop centering the dominant white culture as we look for solutions, or recommit yourself if you're already doing this important work. Okay, so this is going to be a really easy step one, and it'll only take you about a minute. So just grab a pen or pencil and write this down. You're going to go to momscleanairforce.org. You'll see a header bar. In blue will be the words take action. Click on take action, and you'll be redirected to a page where you can take the environmental justice pledge. Thanks so much for inviting me to speak today. I want to welcome participants to email me. My address is on the slide with any comments or questions. Thank you.
Thank you so much, Melissa, for your presentation. Last but not least, I'd now like to introduce our final presenter, Will Barrett. Will leads the American Lung Association's work on California clean air and climate change policy, focusing on vehicle emission standards, smart growth, and clean fossil fuels policy. Will represents the American Lung Association before the California legislature and federal, state, regional, and local agencies engaged in clean air and climate policy. Will, you may unmute yourself and begin your presentation.
Thank you very much. I appreciate the opportunity to join everybody today. My name is Will Barrett. I'm the Director of Clean Air Advocacy with the American Lung Association, and really wanted to build on what some of my colleagues have talked about here. Ultimately, there are significant health effects associated with the growing risks of climate change. Wildfires are a major source of concern throughout the Western United States. And as somebody who lives in Central California, we certainly have seen firsthand over the last several years the impacts of these devastating and catastrophic wildfires on local and regional and broader air quality across the Western US and even further reaching. Fires exacerbate existing pollution burdens and disparities, and can drive major increases in pollution in communities that are typically accustomed to cleaner air, both at the source of the fire and far from the fire itself. I'll describe our most recent State of the Air report and the effects that we've seen, some of the policy responses that we've seen in California related to the fires, and looking at ways to prevent future catastrophes. We'll also talk briefly about the opportunities to engage in clean air and climate action and advocacy among the public health and medical community. So with that, I'll hopefully move ahead to the next slide, and really just wanted to give a quick overview of the American Lung Association's State of the Air report. Our 2020 report was released in April of this year, and this was our 21st annual sort of report card on local air pollution conditions across the United States. We use US EPA approved monitoring data and really look at what the local conditions are. And based on that data, we issue grades and ranks to counties. And also we rank metropolitan areas across the United States in terms of ozone pollution, particle pollution in terms of spikes in unhealthy particle days, and then the annual particle pollution levels that we see. And this information is available at www.lung.org/SOTA for State of the Air. For California in this year's report, we saw basically 40 counties in California saw increased particle pollution. And in large part, that was due to wildfire smoke exposures. We know that we've seen in recent years climate fingerprints all over this report. Years ago, we were experiencing drought that drove up particle pollution. We've seen extreme heat driving up ozone pollution. That's our summertime smog generally. And then in the recent years, we've seen these major fires across California driving up pollution in communities that have existing heavy burdens of industrial and transportation pollution, but also in communities that typically have clean air. In this year's report, we note that about 98% of Californians live in county with a failing grade for either ozone or particle pollution. And so we have those three categories of pollution grades, and almost half of Californians live in county with 3 failing grades. And unfortunately, we also know that people of color tend to live in counties with higher exposures and essentially a greater burden with in terms of failing grades, and counties with 3 failing grades in particular. And these are not just California statistics. These are California statistics, but they also bear out across the country, where we see people of color tending to live in communities that are more highly impacted by air pollution and receive failing grades in our report. California cities dominate the list of most polluted in the United States. We have 7 of the 10 most ozone polluted in the US and California, 6 of the 10 most polluted by annual levels of particle pollution, and 5 of the 10 US cities most polluted by short-term particles. And again, those are those spikes in unhealthy particle pollution levels during a day. We also know clearly across the United States and in California in particular, and really across the West, that we've seen climate change really driving pollution levels higher in terms of the conditions associated with ozone formation, and also with the droughts and the wildfires have really ramped up. And in this year's report, we looked at data from 2016 through 2018, and that corresponds with 5 of the 10 most destructive fires in California history. So again, California and ultimately Western US cities dominate the top 10 list of most polluted in the United States. California cities dominate the list of unhealthy ozone days. This is largely driven by our climate and geography that are beneficial to the formation of unhealthy ozone. But we also know that throughout the Western US, the impacts of wildfires have been seen in many of the cities that populate our top 10 lists. So briefly wanted to echo what some of the previous speakers have talked about, the vulnerabilities of various populations in our communities that are at greater risk and oftentimes face greater exposures to air pollution burdens. The idea that everybody is impacted by unhealthy air is certainly true, but we know that there are communities across the population that are more highly impacted and highly vulnerable. We heard earlier about the impacts of exposures on children and seniors and people of color, and one of the earlier slides showed photos of farm workers, and we know certainly there are many additional burdens on the farm worker population that both in terms of extreme heat and the wildfires. And one of the things that during the 2017 wildfires, the Lung Association was involved in a project to provide widespread distribution of masks and air purifiers across the state. And in some of those cases, we really were trying to target to the best extent possible distribution to some of these most vulnerable populations, including farm workers in Southern California. The next slide I wanted to share just briefly is highlighting many of the health impacts and respiratory health impacts of climate change. As you'll see in the top left quadrant of the image here, the communities that are most at risk due to unhealthy air on a daily basis, communities that are most overburdened, are often going to be the same communities that are most impacted by the spectrum of climate change health impacts at the same time, in terms of the wildfires, extreme heat, drought conditions, and other factors that exacerbate existing conditions. And this is similar to the last presentation, where we see the widespread impacts of wildfire smoke. As wildfires are becoming more increasingly frequent and catastrophic, there are significant spikes in local air pollution burdens, but also we know that these burdens become more widespread. The major spikes in pollution on top of existing burdens come in the form of increased particle pollution, increased exposure to toxics that are contained in the fires that vary from fire to fire depending on what is consumed in those fires. And also increases in ozone pollution can sometimes be associated with wildfire smoke, especially in the summer months. We did see even as far as Southern California, impacts from the Northern California fires in 2018 in terms of ozone formation all the way down the state. And again, really wanted to highlight this issue that wildfires have a wide range of impacts, not in terms of geography, specifically at the location, but also far from the fires. So within our 2020 State of the Air report, the 2020 State of the Air report covered data from 2016 through 2018 on air quality monitoring. And so I wanted to show this slide, and this is again available, all the county slides are available on our website, really showing that, Siskiyou County up in Northern California near the Oregon border in 2018 was impacted by multiple fires. There were fires to the south in California and fires at the Oregon border happening at the same time, and really driving up pollution in that community where typically, as you see here, there are typically lower levels of particle pollution burden in that area. But when the wildfires came through, we knew and we saw the significant impacts of multiple fires burning at the same time, and major fires at that. For Alameda County, this is the Oakland Bay Area. again, we see that there's been progress over time and really keeping overall particle pollution levels lower. But with the 2017 and 2018 fires, especially, we see that generating major pollution burdens in the Oakland area, some of the highest particle pollution levels that we've seen. This is on top of the daily grind of pollution coming off of the Port of Oakland from the trucking routes that go through some of the most disadvantaged and highly polluted communities in the area. So adding this layer of particle pollution only serves to create additional burdens, especially in our environmental justice communities that are facing this constant barrage of pollution from ports and other good movement operations. And then just as a quick note on for the Bay Area as a whole, typically we've seen in our report a lot of A grades, for very good air quality in terms of particle pollution. And in recent years, we've seen that start to degrade and shift. And now all of the about 14 counties in the Bay Area experience all F grades in our report. So as in terms of unhealthy days for particle pollution. So I wanted to talk briefly about the responses to the wildfires that we've seen at the state level in California. And a lot of this come in the terms of increased public awareness campaigns. But really important is that the State Air Resources Board and air districts are working to deploy more monitoring equipment that can be used around the state at the time that fires are present. This is both in terms of wildfire events, but also in terms of looking at the smoke related to prescribed fires. So we know that the state is moving forward in many Western states with increased evaluation and use of prescribed fires as a tool to reduce fuel for catastrophic events. And this program is really looking at ways that we can gather more data in real time to really evaluate the impacts of prescribed fire and where that fire behavior goes in ways that we can reduce the impacts of that, while also dealing with the fact that the wildfires are an ever-present threat, especially in the urban-rural interface areas. I also want to note, really importantly, the state passed a law just last year that would allow for the development of a program to create wildfire smoke shelters, a grant-funded opportunity to really ensure that people who are homeless, live in communities or in housing that doesn't have adequate ventilation, as prior speaker discussed, have resources in the community where they can go, especially important, again, for people without the means to evacuate or move out of the area. So really wanting to make sure that our most vulnerable populations, communities that have the least amount of resources to address and escape from wildfire smoke exposure, have places to go where they can get relief and have a way to escape the smoke exposures. And then also wanted to note that the real need to evaluate housing siting and other infrastructure for wildfire risk, given that many of the extreme wildfires that have happened in California have happened in communities, have gone through communities that are located in high wildfire risk areas, and really needing to reevaluate and evaluate future placement. So our next slide, I just wanted to kind of walk through some of the advocacy work that the American Lung Association is doing. And this is our Health Professionals for Clean Air and Climate Action, and really wanting to highlight the fact that the voice of the public health and medical community in explaining the air quality and climate change burdens and the inequities that we see are being addressed as a public health crisis. This campaign that we have basically is our focal point for bringing in health and medical professionals to help tell this story, to really bring the story of their experience in the clinical setting to life, and really help to put a face on the medical urgency of fighting for clean air and climate change. And then in closing, I just wanted to invite everybody to look into our website, take a walk around the website, find the resources we have there, take action, sign up for our newsletter so that you can stay up to speed on some of the most urgent, pressing actions that we can all take together, to reduce the major sources of pollution that impact our most disadvantaged communities, ensure that policies are targeted to investment and cleaning up the pollution burdens in our most impacted communities, make sure that we're maintaining progress under the Clean Air Act to actually clean our air and continue that progress so that everyone grows in a more resilient and healthy way moving forward. We want to also make sure that, again, we're making the connection to climate change as a threat to public health first and foremost, and the fact that the communities that are most impacted today due to the high levels of air pollution are going to be the same communities that are most impacted by the myriad threats related to climate change. So with that, I'll look forward to the question and answer session and really appreciate everyone's time today to learn more about the wildfires.
Thank you, Will, and thank you to all the presenters. At this point, we're going to transition to our Q&A portion of the webinar. And so I, at this time, I invite all the panelists to share their videos, and we'll get started. You know, just before we start into the questions, I wanted to remind folks that this webinar is being recorded. And so we'll send out a follow-up email to all registrants, including the recording and some of the slides, as well as a survey to help us improve our webinar experience. And again, it's not too late to answer or ask any questions through the Q&A function at the bottom. And we'll take as many questions as we can at this point. And then the rest we'll try to answer offline. So with that, again, thank you to all the panelists. This was very informative and a very great kickoff to wildfire season. And that we have several questions, and I'll kind of start and offer questions to each of the panelists. And if anybody else wants to jump in, feel free to. The first question we received is regarding greenhouse gases, and if are there any best practices or evidence-based recommendations on the critical roles of public health agencies and our partners to justify asking policymakers how to fund our work? And this question is by Dr. Jim Guadino. Apologies for the pronunciation. Wayne or anyone else want to take that question?
So as a scientist in EPA, you know, that's in terms of research funding, I mean, EPA provides research funding, but in terms of what might be available in other areas, perhaps Will could address that.
Sure, I think that certainly, you know, right now a lot of states are going through their budget processes to evaluate where they can invest. And I think it's important always to be looking at ways that our policies, especially those that reduce carbon pollution and that may have an economic valuation to them, whether that's through a carbon tax or a carbon fee or the cap and trade programs or other, you know, structures that can be, you know, those revenues that are created through the value of carbon pollution allowances basically can be directed in ways that serve to improve public health. I think that for California, as an example, there are requirements for those dollars that are generated through our carbon value to be directed to communities that are most impacted by high levels of pollution to begin with, so that we're ensuring investment in cleaning up in the most impacted communities. I think that as far as overall public health resiliency, I think there's definitely an ongoing need to ensure that as funding decisions are made, that public health infrastructure is well supported. And I think that, you know, there are ample opportunities to go down that path of advocacy.
Great, thank you. My next question is from Kate Robb, and it's to Melissa. How can we organize our communities right now to take action to create healthier air during a pandemic? And this question, I'm just going to add with moderator's prerogative to extend to the other panelists. When Melissa was speaking, she offered a way to advance to action. And if the other speakers have any advice or tips on how participants can take action on their own as well.
Kate, thank you for your question. I can tell you what we do at Moms Clean Air Force, and it looks a little different depending on the organizer. So in Montana, we host house parties. So we just get together groups of people that have these concerns. We start with our friends or other local advocates or partner organizations. And some of our organizers, like our Latinx organizers, host cafecitos. And it's very similar content, but the framework is different because the culture is different. And some of our Black organizers host table talks, where they also just get around the kitchen table, or they have panels and they have conversations identifying what are the problems first in our own local communities, because we don't really know what to advocate for until we identify the problem. And it's going to look a little bit different from place to place, but it's also going to be really similar, as we've seen, because smoke travels, but policy is different. So what Californians can do is a little bit different than what Montanans can do. So I really think the first step is just get together some friends. If you want to get together and host a party, we have lots of resources on momscleanairforce.org. You can reach out to me if you're stumped, and I can help connect you, depending where you are in the country, to an organizer near you.
And this as well, thanks, Melissa. I would just add that through our Health Professionals for Clean Air and Climate Action, I think that signing up there gives you opportunities to see some of the local and federal actions that we're involved in at the Lung Association to really drive home the message that we all need clean air, and that there are many policy advocacy opportunities that we're engaged in, both at the federal level in terms of setting stronger national standards for particle pollution, for example, as a current campaign. At the state level, the question was related to COVID and the pandemic, and how can we ensure clean air coming out of it. In California, we've seen an unfortunate increase in lobbying by major polluting industries who are essentially, in our view, looking to use the COVID-19 pandemic as cover for rolling back and stalling clean air policies that are critical to improving public health, especially in our most disadvantaged and polluted communities. For example, we have a rule tomorrow that's going to be adopted, hopefully by the California Air Resources Board, related to zero emission trucks. We also have a hearing tomorrow related to requiring oil tankers to clean up at their act when they come into California ports by plugging in, rather than idling their engines. And we know that the port communities bear ungodly amounts of pollution that impacts their health on a daily basis. And these kinds of policies really speak to the need to advance clean air, especially in times of a lung health pandemic, because we know coming out of this, we're going to need everyone's health to be improved. We need to reduce these sources of major diesel exhaust. And I think that there are these types of opportunities coming forward across the nation that health professionals can really get behind and should get behind to really strengthen community resiliency and address some of these real environmental justice issues.
So really, I'd like to add to what Will and Melissa have shared, and this is more from a research perspective and working collaboratively or cooperatively with communities. And coincidentally, we are actively working with the city and county of Missoula in Montana with a what you might call a community engagement research project, or as we call it in the Office of Research and Development, a solutions-driven research project. And the way this began was to, once we established our relationship, was to specifically ask the public health officials in Missoula, what is it that you specifically need? If we could solve one problem for you, what would it be? And they gave me a list of 17 problems that they needed solved. And so we are tackling one, which I don't know if Melissa knows about it, but I think she'd be pleased to know, that we're looking at indoor air quality during wildfire events. And so we're integrating, we have purple air monitors, both indoors and outdoors at 18 different locations in Missoula. And over the last season, we monitored indoor and outdoor air quality. We have some just, really, really interesting results. Because when you send your children to school, you'd like to know that the air that they're breathing is of good quality. And likewise in public buildings or in businesses, fitness centers, and even the clean air shelters, for example. So this is a question that we're working on. Also, the issue of equity came up many, many times in the course of our conversation. What do you do about HEPA filters? They're expensive. And so do-it-yourself HEPA filters is an idea. We are actively looking at the effectiveness and also the safety of do-it-yourself HEPA filtering in our laboratories. And then we've expanded the Missoula project to the Hoopa Valley Reservation in Northern California. So for the next year, we hope to get some very useful information that can really be used by the communities where it's being done. So thank you.
Lovely. I think we have time for just one more question, and I feel like this is a pressing one, which is from Dr. Linda Rudolph. Could you talk about the potential implications of wildfire particulate matter exposure in the context of the COVID pandemic, given any research?
There is very little specific research on wildfire smoke and its interaction with COVID with respect to worsening pulmonary disease. But there is quite a lot of evidence that's already in the medical literature about how particulate matter, and that includes wildfire smoke, in exacerbating pulmonary disease by, let's say, influenza. So respiratory viruses will be worse in the presence of exposures to PM. There's some evidence that after wildfire season, the incidence and the severity of influenza is worse based on that pre-exposure to wildfire smoke. There's also a study that came out of China back in when SARS hit, I guess it was 2003, which suggested there was an association with worsening of SARS with PM. So I think there is substantial data in the literature to make us concerned about this. But at the present time, we don't have any specific information about wildfire smoke and COVID.
Thank you. Unfortunately, we don't have any time for the other questions, but we will do our best to follow up with the presenters and with those who asked the questions. I want to once again thank you to Wayne, Melissa, and Will for their wonderful presentations, and also for to all the participants for hanging out with us this afternoon or morning. We hope that we can continue the conversation. Please visit us at apha.org/climate to learn more and get links to each one of these presenters' websites. So thank you. Take care.
Thank you.